Health officials say COVID-19 is still a threat in our community and around the country. And joining us this morning from Gundersen Health System to discuss is Megan Meller. Good morning, Megan.
Good morning. Thank you for having me this morning.
Well, nice to have you. Now, Megan, what are the latest numbers in our area regarding COVID-19 and its variants?
So really across Wisconsin, cases are down, which is a really great news. So at Gundersen, that translates to about 40 to 50 cases each day. But, with school starting, that is kind of a concern because we always see respiratory illnesses creep up when school starts.
And so are people still being hospitalized for COVID? Is that still, even for the vaccinated?
They are. It fluctuates each week to week, but on average, we're seeing about 500 to 550 hospitalizations each week. At Gundersen, that's about, I'd say, 5 to 10 cases. So it's been holding pretty steady throughout the past couple of months.
And you mentioned this earlier with the kids going to school. What do we need to know about COVID as extracurriculars kick off and the school begins for our kids?
Like with any respiratory illness, it's know the symptoms. Overwhelmingly, we're seeing people presenting with very mild symptoms. So sometimes it's a headache, it's a cough, they're just kind of feeling under the weather. So know those basic core symptoms, get tested. We have antigen tests, available. They're easy over the counter. Get tested, come in and get tested here. Know before you go. And then if you're feeling under the weather, it's best just to stay home if you're not feeling well. It's the same practice we preach when it comes to colds, RSV, and the flu.
And basically just follow the protocols for whatever school district you're in. Well,
correct.
We're also hearing that vaccinations for all things like measles, mumps, even polio, polio seen in New York, and we're lagging behind. What are the impacts of these vaccinations?
The impacts are huge. When we're seeing a decrease in overall childhood immunizations, it means an increased risk for those illnesses that we previously haven't seen before. They went away, like mumps, measles, and now polio, which we are starting to see cases creep up. So it's really important to make sure that your child is on time getting those vaccinations, or if not, to get caught up. And Gundersen is trying to create we're creating immunization clinics. So parents can just schedule, they can walk in, they don't have to make a special appointment. We're trying to make it as easy as possible for kids to get caught up.
Okay, Megan, well, thank you so much.